Hello, today we will talk about dentinogenesis. A tooth is composed of these three layers. Enamel, dentin, our presentation topic. The dentin is the second or middle layer of the tooth, the layer directly beneath the surface enamel. Pulp. Now let's talk about dentin, a mineralized tissue that forms the bulk of the tooth. In the crown, it is covered by enamel, and in the root by cementum. It is rigid by elastic tissue consisting of large numbers of small, parallel tubules in a mineralized collagen matrix. The tubules contain the long processes of the cells responsible for forming the tissue, the odontoblasts, as well as a small volume of extracellular dentinal fluid. Dentinogenesis. Anatomically, dentin is divided into coronal dentin, in crown, and radicular dentin, in root. The cells that are responsible for dentinogenesis are odontoblasts. Each odontoblast has a cell body, process, and neck. The different stages of dentin formation result in different types of dentin: mantle dentin, primary dentin, secondary dentin, and tertiary dentin. And now formation of odontoblasts. Amyloblasts secrete some signaling molecules and growth factors, which are responsible for the differentiation of cells of dental papilla into odontoblasts, which are large columnar cells arranged in a well-defined layer, sending their odontoblastic process through dentin. It is rich in endoplasmic reticulum and Golgi apparatus. And now formation of mantle dentin. The odontoblasts begin to move toward the center of the tooth, forming an extension called the odontoblast process. Thus, dentin formation proceeds toward the inside of the tooth. The odontoblast process causes the secretion of hydroxyapatite crystal and mineralization of the matrix. This thin area of mineralization is known as mantle dentin and is a layer usually about 20 to 150 micro-m, equal to 1.5 millimeter, thick. Now let's go to formation of circumpulpal. Normal circumpulpal dentin directly underlies mantle and comprises the bulk of the tooth primary dentin. Circumpulpal dentin forms after mantle dentin, which is more mineralized than mantle dentin because of more secretion of minerals from odontoblasts. And now the primary dentin. The most prominent dentin in the tooth lies between the enamel and the pulp chamber, near dentino-enamel junction. The outer layer closest to enamel is known as mantle dentin. For the secondary dentin. Secondary dentin is formed after root formation is finished and occurs at a much slower rate. It is not formed at a uniform rate along the tooth, but instead forms faster along sections closer to the crown of a tooth. For the predentin, it is a thin layer, which borders the pulp, a layer of organic matrix that has not yet mineralized, and as it mineralizes, it's become a secondary dentin. For the tertiary dentin, is the dentine formed in response to various stimuli: 1. Trauma, 2. Attrition, 3. Caries. So when the tooth is injured, odontoblasts move out to the site of injury and form tertiary. The histology. Dentin appears in different patterns of mineralization front. The junction between predentin and mineralized dentine under the microscope according to the speed of mineralization, where at slow mineralization a linear pattern forms, while in faster mineralization a globular form appears caused by the formation of chalcospheroids, which are spherical hydroxyapatite crystals that fuse and arrange in radiating patterns. The healthcare. Brush your teeth gently on both sides with a soft bristle toothbrush and fluoride toothpaste. Every 3 to 4 months, replace your toothbrush. Use small circular motions and short back and forth strokes. Brush gently and carefully along your gum line. Brush your tongue lightly or use a tongue scraper to keep your mouth clean. Use dental floss, pre-threaded flossers, a water flosser. شكراً للاستماع. نرجو أن يكون نال إعجابك دكتور. مجموعة طلبة طب الأسنان سنة ثانية، جامعة العلوم والتكنولوجيا الأردنية. إشراف الدكتور القدير أشرف الشاب.